Welcome back. Look at Edmonton this morning for you on this Friday. Let's get things going. So this is a very important topic. Once seen as a death sentence, stigma and misconceptions have led to an HIV narrative that no longer rings true. The Public Health Agency of Canada's 2018 HIV surveillance report revealing that the number of new HIV cases in Canada has increased by 25.3% since 2014. But those with an undetectable status can live a healthy and normal life. We're going to break things down here, joined by Dr. Michael Fanous with so much information, and we're going to break down some of these stigmas as well. Good morning to you, Doctor.
Good morning.
I want to begin with the misconception that often some people use the term HIV and AIDS as interchangeable terms. Why is that so dangerous to do, and why do you think that still happens?
Yeah, the confusion between HIV and AIDS goes back to the days of the AIDS crisis in the 1980s. But as we learned more about the virus and what it can create, we know that not everybody with HIV ends up with AIDS. So AIDS is the third or the final stage of an HIV infection that we can prevent with medications. In fact, there are some countries like Australia that have claimed an AIDS-free generation, meaning that nobody in their country is diagnosed with AIDS. Now, there might be people with the HIV infection and they are living healthy, normal lives because the medications today can make someone live a healthy life just as long as someone who's HIV negative. So the first phase, when someone first gets HIV, is called the acute phase. And so this seroconversion generally comes with symptoms. But then people can live years now with HIV, and we can hopefully prolong or prevent AIDS with medications. It used to be a tablet once a day, but now, as of last year, Meds Expert, one of the many places that serves the HIV community, we have injectable medications. So that long-acting injections can go into somebody's body for a month or two, and they remain HIV undetectable. Now that term basically means that the amount of virus is so low, we can't detect it, and they can't pass it on to partners.
Dr. Fanous, I want to go backward a little bit and to talk about knowing your status, testing and knowing your status, which is really important. What is that process like?
So the process is real simple. Back in the day, people would have blood drawn and they could wait, 1 or 2 weeks for results. But now we have a whole host of different options available. We have rapid testing. We have anonymous testing. We have confirmatory testing that also uses a blood draw. But with the prick of a finger, we can tell people if they are HIV positive or not within a minute.
So let's now jump forward. You talked a little bit about treatment options that are available, the ease of testing. As you said, it's much different over the years. So why is it that a lot of people are still nervous about wanting to get tested?
That's a great question. And so the barriers to testing and to HIV knowledge include many things. There is still a stigma against those that are HIV positive, and that prevents a lot of people from seeking care or getting tested. Also, till this day, although we celebrate Pride with a lot of excitement, there's still a lot of communities where being LGBTQ is not celebrated. And so homophobia and transphobia, and what we also call serophobia, the fear of those that are HIV positive, prevents people from accessing the care that they need. We all need to get tested for HIV, gay or straight, black or white, old or young. HIV affects us all.
So let's talk about the stigma, and I want to make sure we hit home with this point. So the idea of undetectable equals untransmittable. What do you want to leave our viewers with?
So if somebody is HIV positive and they're taking their medications as prescribed and have sustained what we call an undetectable viral load, meaning that amount of virus in the blood that is so low that we can't detect, then we say that this person can't pass it on to their sexual partners. And this is revolutionary. That means people can have kids and not pass HIV on to their children. There are people that can have condomless sex and not pass it on to their sexual partners. And so undetectable status is something that is powerful. It's something that we've known about. And now, thanks to Bruce Richmond, there is a U equals U campaign. Undetectable equals untransmittable. And that's our main messaging here at Meds Expert on Church Street, but to our whole community all around the country.
Dr. Fanous, where can people find out more?
Wonderful question. You can visit www.medsexpert.ca. We have pages there about PrEP, which is a revolutionary way to prevent HIV with a pill a day, PEP, and how to get tested for HIV and become HIV positive undetectable.
Okay, great. A lot of amazing information there. Please do visit the website. And I should note as well, Dr. Fanous will be joining Tracy Moore for an episode of Cityline Real on Pride, airing on June 16th at 3 p.m. Eastern. Thank you so much for your time today.
Thank you very much.
All right, time right now is 8:45.